when you paint this white.
Oh, I have a beautiful picture.
Hello, this is Dr. Patty, and we are going to start our webinar today. And I don't know where you guys are, but we're sitting in a pretty bad rainstorm. So if you hear thunder coming from outside and if you see lightning, it's probably that. So today I wanted to do a little bit of a basic thing starting with the gut. And I will be talking a little bit about constipation and irritable bowel syndrome and reflux symptoms. And I think that, you know, when you really think about it, and when I think about my personal practice, I can tell you that about 50 to 70% of people really walk in through the door with some complaint in this area. And when I was practicing as an OBGYN strictly, I really didn't really know what much to do with this area and mostly referred these out to the gastric community. And if the workup was negative, they generally came back. But after recognizing the impact that the gut has on everything, this is probably one of the areas where I would say in almost 100% of our patients, in some way or the other, we're working on the gut. When we, let's see here, how do I, okay. And as far as, you know, the gut and why start with the gut, we know that about 70% of our immune system depends on the healthy mucosa of the gut. Traditionally, the birth allows the passage of microbes from the mother to the sterile infant gut. And it's a relatively quick process, but it takes about a month for a newborn to actually establish a solid population of gut flora, and about another year for it to resemble the flora that we have as an adult. We know that the flora and the health of the mucosa is responsible for breaking down carbohydrates, for activating hormones, for producing certain B vitamins. And when I have people that, let's see here, I really want to go to the when I have people that are looking for solutions to a variety of conditions, whether it's an inflammatory condition that has to do with diabetes or hypertension or cardiac or reversing plaque, or whether it's rheumatoid arthritis, Alzheimer's, any kind of inflammatory condition, eczema, you always want to do a very careful history on the gut. I always ask every single patient, and on our questionnaire we have this, how many bowel movements are you having in a day? Or how many bowel movements are you having in a week? You can't believe how many people will say, oh, a couple of times a week. And that's kind of normal for me. And we have to think about that a little bit, whether that is ideal or not. And then I always ask every patient whether they have any kind of heartburn, bloating, or indigestion, because all of those are signs that nutrition is not entering the body like it should. So when we ask the question of how often we should move our bowels, nature programmed the bowels to contract when we eat. If we look at an infant or we look at a pet, this programming of nature is evident, and it's lost along the way through social training. And what I mean by that is most people want to go at home, and it ends up that going once a day turns out to be the accepted non-constipation definition. But when the bowels don't move 2 to 3 times a day like they're supposed to, not only does it lower the production of B vitamins and serotonin, which is made in the bowel, but it also increases the toxic uptake, which is meant to be eliminated. So as the liver detoxifies our toxicities in phase 1 and phase 2, it dumps into an intestine, which is expected to move a few times a day in order to get these things externalized. When they don't, these things are actually reabsorbed. We also moving our stools less than 2 times a day results in lower nutrients, lower B vitamin production and serotonin, and lower estrogen and hormone metabolism in general. So it becomes quite important. That picture I don't like to show for too long, but I never used to believe that something like just moving your bowels less often than you should could actually result in blood changes that you could visualize. But by doing live blood observation under a microscope, you can actually see the reuptake of some of the toxicities and some of the bacteria right in the bloodstream. And I can tell you that these are always much more predominant after meals where there hasn't been a bowel movement following it. So it turns out that it's a real phenomena, and if you ever have a chance to look at live blood observation, you can actually observe this for yourself. There are studies, of course, that constipation affects the quality of life, and these are some more recent ones, but if you look, the data on this dates back, and most importantly, for those of you who have lots of people working for you, constipation associated with lower productivity pretty significantly. So you really want to make sure that your employees are not constipated. Because it really significantly lowers an index of a lot of health-related quality of life, but significantly lowers work productivity by almost 50%. So absenteeism. As far as diagnosis, there are some diagnoses charts that are used officially, but I can tell you that if the stool is not moving well a couple of times a day, that, in my opinion, is something to be treated. So we basically treat anyone who says they're having less than 2 stools a day. A couple of very obvious things: increasing the fiber. We know that the average American diet has something like 14 grams of soluble and insoluble fiber, and we're really looking for 20 to 35 grams. We also know that this is one of the best ways to lower cancer risk. So this is an area which we should pay attention to. It isn't always about just taking some pills and retraining the bowel. Increasing the liquids to half the body weight in water in ounces, and I can tell you that this is usually a very significant contributor to constipation. And increasing physical activity. Sitting around all day just doesn't work. There are a lot of medications that are involved here, and sometimes people use things like castor oil packs, and they've actually worked very well. But I'll tell you, the way that I have found really makes a big difference. I've mentioned to you the dietary correction, and I can tell you that this dietary correction we're using in 100% of our patients. So 100% of our patients are getting some kind of counseling on nutrition, on fiber fat content, vegetables, protein ratios, and so on and so forth. And almost 100% of our patients are having some kind of thyroid correction, either through nutrients that we use Essentials 5-in-1 to boost the thyroid activity, or they're getting it by actual thyroid manipulation. But the other part is that even while we increase the thyroid, it's important to try to have a regimen which will retrain the bowel to learn that when you eat, the intestines should contract. So this is a regimen we use. We basically use it for 1 to 2 months, and by the end of 2 months, people are generally retrained as far as the bowels are moving regularly and the thyroid is corrected, so we can stop these regimens. We have very, very few people, some people who have had chronic issues maybe from childhood, but other than that, most people stay on this regimen for a month, maybe 2 months, and then their bowels start moving regularly. So what we're doing is using the Pure Cleanse Bowel 1 and the Pure Cleanse Bowel 2 formula, with the herbs in the first one and the fibers in the second one, and an upper and lower probiotic, which is Pure Biotic. This works about 85% of the time to really correct the constipation pretty permanently. Sometimes it doesn't work at all, but that's much more rare. And there are some stimulants in this and some things that work osmotically, but the idea is that this is a retraining. So that's why you really want to do it with every single meal, because you want the body to learn back what it used to be, which is when you start chewing, the intestine starts contracting. There are really no formulas that I've seen that are like that out there. And with the probiotic, it's critical to have a probiotic that's covering both the upper and the lower intestine, and the probiotic I use is this one right here. And with this combo, I've had really pretty good luck. Again, this is one of the ones that, if you compare it with some of the other ones that are out there, really has a much more comprehensive upper and lower bowel coverage than the other three that are listed over here, Purine, Cap, Cymogen, and Metagenics. And similarly, that continues on to the next page, and the price is very comparable. But this is extremely effective within 2 months with thyroid and diet correction. And I want to give you so that's one case of constipation. I want to give you 2 cases that have to do with patient with actual big gastric complaints. So this is a patient with a 10-year history of irritable bowel syndrome and reflux and bloating. And you can absolutely assure yourself that anybody with a 10-year history of intestinal issues will have nutritional deficiencies and will absolutely start to have fatigue, energy level of 3 to 5 over the last 3 years is what this gentleman was reporting. And this is what you can expect, because you can expect that the nutritional load, especially the B vitamins, B12, folate, and various other ones would be very low. We did do a CDSA panel on this gentleman from Genova Diagnostics, which is up in North Carolina. And I can tell you that this would not be a test that would be necessarily required, because with that history, the treatment plan that we put into effect could have been guessed without knowing this, but it's nice to have this, and sometimes I do use this testing, but this is not something I use often these days, and actually I'll show you the next case where I didn't do this kind of testing on a similar case. But the couple of things to notice here is that the putretive short-chain fatty acids are very high, which means we really are not digesting well. We also can see that in the gut immunology panel, the eosinophil X, protein X is very high, which means that there's a very high degree of inflammation going on, and that's something that you definitely are going to want to lower. Other things of note on this panel was that there was absolutely no beneficial bacteria growing in the intestines. You can see absolutely no growth. And although there were no parasites or ovar, any of that detected, my feeling on this is that this kind of a panel gives you some idea, but it's not completely excluding all infectious sources. And the reason why I say that is because when we do testing on the intestine for parasites or bacteria, we have to remember that of the ones that we know how to identify and grow, there are tenfold many more that we won't identify and won't grow. So sometimes we have to realize that if the gut immunology and the immune system in the intestine and the flora in the intestine are intact, then they will not allow an overgrowth of potentially pathogenic organisms. And that is our normal mechanism. So if you have a very low number of beneficial bacteria, even though we grew nothing in terms of pathogenic bacteria, you can be rest assured that there are some pathogenic forms of bacteria that are in there that we're not detecting. Usually the mechanism of putting in a strong probiotic takes care of it, but it's not always the case. So this gentleman, with the mechanism that we normally would have used, which is we usually get people feeling better before we start a very significant bowel regimen that becomes hard to follow. So most of you know the 5-point program where we're using hormones and then nutrients, then removing toxicities, then mind, then body. It's 5 areas that we're correcting and restoring to optimal to restore optimal function to the body. And so in that theme, we started with some thyroid and doubled it and started with Essentials 5-in-1. Now, Essentials 5-in-1 would have been a multivitamin which some people with reflux would not tolerate. And this gentleman, actually, it's not noted here, was on a proton pump inhibitor. So even though we started the Essentials, we usually tell them that if they don't tolerate it, just drop it quickly, because once we get the reflux corrected, they would be able to tolerate it again. And we used B12 at 10,000 micrograms per mil, and it was methylated B12 and folate, 400 micrograms IM every week to twice a week. We use this pretty liberally. It's water soluble. You don't have to have fear that it's going to collect in the body and create a toxicity. We also immediately did the following. Dietary-wise, discontinued dairy, started a probiozyme and a purebiotic, which is the enzyme in the probiotic, to start helping with the digestion. We know that in order to correct a condition like this and the kind of inflammation we saw in the CDSA panel, that we would have to reduce all inflammatory or irritating proteins in the intestines. And those, number one, is going to be casein, which comes from cow's dairy. There's also some in goats, but cow's dairy has the most casein in it. And so that's why we discontinued that first. But then any animal products, any meat, fish, eggs, dairy, any of that. So, and in this diet, we don't necessarily ask them to be gluten-free. We know that we're testing people for gluten allergies, and although gluten is an irritant to a lot of people, it's the primary irritant is going to be all the animal-based products. So we usually remove those first and see how that goes. From the studies, we know that we're in line with what would be done. We know that probiotics have been shown to help in the treatment of Crohn's and colitis and C. diff infections and traveler's diarrheas and yeast infections and allergies. I can't tell you how many allergies we have corrected just by giving the proper probiotic. And dermatitis, eczema, psoriasis, these all start in the gut. A simple correction of the bowel flora, and that doesn't necessarily mean, when I say simple, that you start a correction in the bowel flora and you keep it going, because a good probiotic should be able to reestablish the gut flora in both the upper and lower intestine and give you a state of balance where you don't have to continue the probiotics. So just so you know, most of these people are not continued on probiotics forever by any means. Improves the immune system and, of course, reduces the severity and duration of colds. If I have any feeling that somebody's been exposed to a virus or has a virus coming on, or even myself, I immediately load up with probiotics and vitamin D, and generally within 24 hours, whatever the symptoms were are gone. I showed you the profile of the probiotic. And the enzymes, you always want to make sure that you've really got enzymes that are covering all of the bases that are listed here, the carbs, the proteins, the fat, and this is what we're actually using in Probiozyme, essentially something that's covering all of the food groups. And using this mechanism by week 4, this gentleman was definitely a little better. And of course, we continued to correct the thyroid, increase the thyroid to 76, and we're pretty aggressive with the thyroid, and this was a slow-release thyroid, so in his case, he would have kept going up on that thyroid about every 4 weeks. But considering the fact that his IBS was already 30% better, his reflux was already 30% better, his bloating was 30% better, his energy was now a 6 out of 10, this is when we began a 12-week plant-based program with the enzymes and the probiotics. The plant-based program that we began, again, I was explaining to you that we use this for allergies and bowels and skin condition and any kind of fibromyalgia, lupus, arthritis, any of those. Usually the duration is 2 to 3 months, and it's basically a plant-based diet with vegetables, whole grains, nuts, and seeds, except for if they have diverticulitis, we don't use as much nuts and seeds, and avoiding all meat, fish, dairy, and eggs, and minimizing the canned, box, processed, refined, fried, charred, and overcooked. Pretty common, logical stuff. Again, if any of you haven't read the China study and looked at the inflammatory response of casein compared to plant-based protein, that's something that might be worth looking at. We give them a vegetable list. You'll have access to this. This webinar will be on the MD Prescriptives website. But this is just a basic list of vegetables so that, you know, what happens is when people go to plant-based diets, you might think that it's enough to tell them to just start eating plants. But what happens is that people need a lot of help to understand that there's such a wide variety of things that they could use. And the ones in yellow here are the ones that detoxify the liver better, so that's why they're out in yellow. But we actually have a consult where they sit down and we teach them about different kinds of plant-based proteins, how to use hemp, how to use superfoods, how to use blue-green algae and aloe and coconut and all the superfoods that are dense in nutrition. Of course, we know that because it takes 35 peaches and 4 apples to make 1 peach and 1 apple from 10 years ago, partly because the soil is so poor and partly because genetically modified nutrients flow away from the nutrients flow away from the roots of the plant rather than towards the plant. So we really have to step up superfoods in order to be successful in getting the right nutrition. So we actually have somebody who sits with them and teaches them how to use these vegetables, how to use the superfoods, and we have a lovely little recipe book coming out soon, which should be out there sooner rather than later. But at week 14, you can see that the energy levels 8 to 9, the GI symptoms are resolved, and in this case, we happen to have a post result on the CDSA, and we can actually see that the putretive short-chain fatty acids, which were not being digested, are now digested out, and the eosinophil X has gone down, and even the calprotectin, which is a sign of inflammation, which is top on the previous one, is also down. It's actually undetectable. So you've kind of proven that you have reversed some level of inflammation, and I am not showing you in this case. One of the things that this gentleman would have had done for sure would have been a SpectraCell, and in that case you would be able to show that the nutrition also has improved. So obviously once the nutrition is improved, you have a great deal of possibility of keeping this person healthy and repair the gut. As far as the future, how do we take them off plant-based diet? Someone like this, I would encourage them to eat as plant-based as possible for quite some time, and if they start to gently add back meat proteins into their diet, that they keep the superfood volume up and that they keep the dairy down. And in fact, I would suggest that everybody cut the dairy down to the minimal in any case. As far as supplements, this is the kind of situation where really all of those supplements that were meant for the gut, the enzymes and the probiotics, they're not necessarily think they need to continue. So those are things that you also wean them off of. So the nice thing about a program like this is that once you lower the inflammation in the gut for a 2 to 3 month period of time or 4 month period of time, you're actually able to correct the immunology and the balance of the gut so that you can bring them off of these things. And that's what's nice about these mechanisms, that you don't have to keep them going with these things. So this is another case, and this is a 65-year-old male with a 1-year history of everything I eat kills my stomach. This is actually, he was very irritated because he was a very active person who has done, basically kept a very active life. He had some stressors in his life, and he feels that's where it started. But over the past year, and he was a thin man to start with, he had lost about 10 pounds. He had had a complete gastric workup at several local GI doctors, and it was negative. He had also gone to Mayo Clinic and had, he said, a 1-week workup there and at Shands, and all of his paperwork showed he had had upper GIs and lower GIs and MRIs and CAT scans, and he pretty much had most things that one would expect to have with this kind of complaint and being on a quest, and this man was definitely on a quest. Energy level was a 5 out of 10, again, totally expected with anything that affects your intestines, and mood was a 5 out of 10, just very upset and annoyed at having lost his activity level in life. So what we offered him was a standard regimen. And the standard regimen, I'll show you what we used, which would decrease gut inflammation and allow resolution of the symptoms. And again, in 80 to 85% of cases, this standard regimen, which I'm about to describe to you, would do the trick. We also offered CDSA testing to provide additional insight before the regimen. And I think I was mentioning to you that the patient that I showed you before was a patient that I had done in 2008. But this patient is a more recent patient, and I can tell you that the utility of that test and expending money on that test, not necessarily, when you know that you can correct it over 80% of the time with a standard regimen, a lot of people would actually choose that. And in this case, he actually chose that without the CDSA. And we also offered B12 injections, 10,000 micrograms of methylated cobalamin and 400 micrograms of folate. This gentleman was offered the possibility of thyroid and testosterone and essentials 5-in-1, but you can see as to the last note that we didn't do any of those, partly because of hesitation on his part and partly also because in his case, with the story of everything he eats kills his stomach, I didn't want to put the essentials 5-in-1 on board. So his regimen is going to be completely focused on only those things which would heal the mucosa of the intestine. So what will it be? His standard regimen for intestinal inflammation included the plant-based diet that you saw before. In his case, we did not ease him into it with reducing dairy first and then going to the rest. We actually had him sit down and just learn how to switch himself over to a plant-based diet. He started with a probiotic, the pure biotic, and the enzymes. As we had mentioned, those work in the upper and lower intestine. And again, one at breakfast, one at lunch, one at dinner. He started with 3 grams of glutamine at each meal, and this is from pure encapsulations. I'll show you the pictures so you can identify them. Glutamine is a natural substance in the intestines. You may know that glutamine can be used in a dose of anywhere from 6 to 20 grams. 20 grams is the dose you would use if you're trying to protect the gut that is being exposed to chemotherapy or radiation, and we have successfully used actually glutamine and aloe arborescens, which you see under there from Premier Research Labs, very successfully to protect the gut from radiation and chemotherapy damage in many patients. So this is something that you can use independently of the probiotic and the enzyme. But in this patient, we put him on all 4 of these things along with a plant-based diet. The L-glutamine looks like this. We use the 1,000 milligram or the 1 gram capsule. And again, it's in a vegetable cap, no dyes, no preservatives. Aloe arborescens, which we're currently getting from Premier Research Labs in Austin. And it is definitely different from all of the other forms of aloe that I've used. So I am very keen on using this form of aloe, which is the arborescens, at least for the first 2 bottles and the first 2 times a month or 2. And then after that, we ask them to shift over to keep aloe in their diet as an anti-inflammatory, but they can use an aloe gel or an aloe juice, which is a little bit lighter. But initially, I absolutely want them to be on this one. By week 4, he still hadn't lost any more weight, but we probably wouldn't have expected that by week 4. But his pain was reduced, and just through that, his energy and mood were a little bit better. And I'm jumping forward a little bit to week 8 because we didn't really change anything. We just kept it just like that. And this is now a 2-month regimen of plant-based diet, no dairy, no meat, no fish, no eggs, no canned, box, fry, all of those things. And he's gained 2 pounds of weight. His energy is good. His mood is good. And he says he's starting to feel like himself again. And I think that, it sounds rather simplistic, but this actually, his plan was to continue the diet for another 4 weeks. That's what we suggested, and reintroduce some meat and fish. We really recommend trying to stay off of dairy, especially cow's dairy. And if we had tested originally with anything, we might have retested, but we didn't. I always mention the role of antibiotics if you had a patient who was not getting well on this regimen. So say you used a regimen like this, and some of the ones I've pointed out, we're talking about 80–85% cure rate on those, which is very good, especially because it's, it's something where they don't have to continue a lot of rigmarole to keep that result. But what do you do with that 15 to 20% where you're not really getting the kind of complete result that you're looking for? And this is where you have to consider the role of even empiric antibiotics and some other kinds of things, like looking at gallbladder and infection and things like that, which I would be covering probably in part 2 of the gastric, starting with the gut, maybe ending with the gut. So that might be somewhere to go next. But never forget that there is a role for empiric antibiotics in these kind of gut issues, even if you don't identify bugs. Other conditions treated successfully with these regimens I'm listing here, and even people who've had, going to surgery on some of these items. So we know that this works. And this is a picture I took yesterday morning. I have 7 new puppies in my house, and I can tell you that if any of you have ever dealt with an infant or a small pet, you realize that every single day, your major focus is on what their intestine is doing. how they're eating, whether they're vomiting, whether they're gaining weight, and whether they're pooping, and whether they're pooping right, and whether it looks good or it has blood or what it has in it. So it's interesting that when I named this lecture starting with the gut, of course I didn't expect to have 7 new puppies, but those are the 7 new puppies eating. And so I'm ready to take questions, and I think that there's some kind of adjustment that has to be made for me to take some questions. Okay, so the first question is, how important is it to use prebiotics and enzymes with probiotics? So the probiotic formula that you use should have a prebiotic in it. And in the case of the probiotic that we're using right now, it does have the fructose oligosaccharide for the prebiotic. And it is important because it is what they feed on. As far as the enzymes, that's not always used together. I don't always use enzymes in probiotics, and I'll give you a perfect example. If I'm trying to just prophylax somebody on antibiotics, or I'm trying to treat the constipation, I don't necessarily use enzymes. That doesn't mean that they don't need enzymes, but you're trying to correct the problem with the least number of bottles as possible. So generally, in a case like that, I would leave the enzymes out. The enzymes I always use in anybody with any kind of bloating, reflux issue, and of course, in the kind of issues that we saw in the last 2 patients who needed the enzymes. Will having had gallbladder out affect the GI testing result, for example, maldigestion of fats? And that's a very good question. You would expect that it would, but I have not done that testing on enough people with gallbladder out to actually verify that that is the case. And pretty much anybody who has the gallbladder out, I standardly recommend that they get on an enzyme with lipase and some of the fat digestion enzymes in it. Any other questions? Well, we are concluding our webinar today, and you guys will find, I'm getting another question. Have you tried the medical food of Metagenics? No, I have not tried the medical food of Metagenics. I know that it's a good formula, but if you look at right now what I'm doing for medical food, I'm generally using a whole list of superfoods which actually come from the grocery store in a whole raw and organic form. And if I need to use a superfood supplement, I'm generally using Pure Greens because it's raw and organic and spectrophotometrically tested, and it includes, you know, the resveratrol and the turmeric and all of the things I'm sort of looking for, spirulina, chlorella, things like that. So, but I haven't tried the medical food of Metagenics. And so you guys will find this webinar on the website of MD Prescriptives, and if you have any questions, you can always direct it to them and it will come to me. So thank you for your attention today. Oh boy. Okay, well I guess there's some more questions here. What is your opinion on enteric coating probiotics? I don't have an opinion on enteric coating probiotics. I don't see any big advantage to it, but you know, there's a lot of theories on what would be better and what would be, you know, more desirable and less desirable. But I can tell you that the ones that I'm using right now do work, so I kind of going with that. Would you recommend a colonic for constipation? A colonic can help you with the lower intestine, but for constipation, you've got to be treating the general reaction and response of the intestine. So if you have a situation where you're just using a colonic to treat constipation, you're not getting to the dietary things, the increased fiber, the generalized response that the body should have to eating. You know, the body's response should be that the minute you start chewing, the intestine starts contracting. That's normal. So you really want to enhance that response rather than doing it through a colonic. Now, a colonic has its value, but it's in conjunction with things that affect the upper gastrointestinal tract. How do you get rid of candida and other yeast with probiotics, or is there additional? So if you have, so we know that yeast basically lives in the intestinal tract. And we know that very often we will identify yeast overgrowth by either identifying a vaginal infection, or sometimes we find it on a gut study, or we find it on you can even find it on a urine study. So the thing to know is that it's obviously just means that the normal flora of the gut generally has not been in a good balance, and that's why they can't be grown. So adding the probiotic by itself generally will not be successful in completely turning it over. And so some of the more milder things we do is tell people, okay, decrease your sugars, decrease your white bits, simple white breads, fruits, and get on a probiotic. And there's other things you can also add to that regimen. My experience has been that if you've had a massive enough overgrowth in the intestines that you're actually noticing it in vaginal tissues or bladder, or you're actually growing it out, you're much better giving 1 dose of diflucan and getting rid of the major dose orally, and then going ahead with some of the other mechanisms. So yes, probiotics is part of the picture, but I don't believe that a large dose of Candida can actually be gotten rid of by probiotics alone. What is the treatment for yeast growth on GI testing? And actually that's the answer that I just gave. Is it better to take your probiotic at hour of sleep or before or after of meals? I usually suggest the probiotic to be taken with the meals or slightly before the meals with the enzymes. It's a convenient time to take it, and it's a very reasonable time to take it. Do you feel Bacillus coagulans is one of the more superior probiotics that is essential in colonizing the gut with other flora, given that it has the most profound ability to grow in different gut pHs and change out the gut pHs so other species that are more fragile and survive the gastric acid of the gut? Bacillus coagulans is a required ingredient in any probiotic. That's absolutely the case. And somewhere between your probiotic and enzyme formula, you should have Bacillus coagulans, but remember that you still need to use a comprehensive one to get the complete response. I have not found that using it alone is necessarily going to take care of the entire issue. What is your opinion on colonic cleansing or fasting to resolve some of the issues you have discussed? I mentioned the colonic cleansing and fasting I have not used in this setting, so I don't have an opinion on fasting in this setting. Diflucan is 1 dose, 150 milligrams. Yes, if you have a very big overgrowth, you can repeat the diflucan dose of 150 after 3 days. And I do think that that really is the end of our session here. Oh, there is a last question. What's the number of probiotics to use 1 capsule 3 times a day when you're trying to treat an issue like this? So all of this will be posted. If you have any questions, please direct them to MD Prescriptives and they'll come my way. Thank you very much. Take care.